Hello everyone. In the sequence of online classes, today I am going to discuss with you about drug allergy and food allergy. A drug allergy is an allergy to a drug, most commonly a medication. Medical attention should be sought immediately if an allergic reaction is suspected. An allergic reaction will not occur on the first exposure to a substance. The first exposure allows the body to create antibodies and memory lymphocyte cells for the antigen. However, drugs often contain many different substances, including dyes, which could cause allergic reactions. This can cause an allergic reaction on the first administration of a drug. For example, a person who developed an allergy to a red dye will be allergic to any new drug which contains that red dye. A drug allergy is different from an intolerance. A drug intolerance, which is often a milder, non immune mediated reaction, does not depend on prior exposure, and the immune system recognizes the drug as a foreign substance, and the body produces certain chemicals such as large amount of histamine in attempt to expel the drug from the body. Most people who believe they are allergic to aspirin are actually suffering from a drug intolerance. Now, what are the risk factors of drug allergy? A drug allergy is more likely to develop with large doses and extended exposure. Common drug allergens, common drug allergens. There are so many risk factors here. I am going to define in the sequence of that. First one is common drug allergens. When a medication causes an allergic reaction, it is called an allergen. And the following is a short list of the most common drug allergens. Number one, antibiotics such as penicillin, sulfa drugs, tetracycline, insulin, iodine, etc. Analgesic like codeine and NSAIDs, non-steroidal anti-inflammatory drugs. Another one is anti-seizure drugs or anticonvulsants like phenytoin, carbamazepine, barbiturates, etc. Now, what are the symptoms of drug allergies? As you know, symptoms can range from mild to life threatening. Even in people who are not allergic, many drugs can cause irritation such as an upset stomach. But during an allergic reaction, the release of histamine can cause symptoms like hives, also called urticaria, is a raised, itchy area of skin that is usually a sign of an allergic reaction. Skin rashes, itchy skin or eyes, congestion and swelling in the mouth and throat. A more severe reaction may include difficulty in breathing, blueness of skin, dizziness, fainting, anxiety, confusion, rapid pulse, nausea, diarrhea, and abdominal problems. Anaphylaxis is a serious allergic reaction that affects a number of different areas of the body at one time and can be fatal. Causes of anaphylaxis can be food allergies, latex allergy, allergy to insects or stings, bites, asthma, or other materials or conditions. Now, a question arises, how are drug allergies diagnosed? A doctor diagnoses a drug allergy by carefully reviewing patient's medical history and symptoms. If a doctor suspects that you are allergic to an antibiotic such as penicillin, he or she may do a skin test to confirm it. However, a skin testing doesn't depend or doesn't work for all drugs, and in some cases, it could be dangerous. If one have had a severe life-threatening reaction to a particular drug, your doctor will simply rule out that drug as a treatment option. Conducting an allergy test to determine if the initial reactions was a true allergic response is not worth the risk. Now, another question may arise, how are drug allergies treated? Or what should be the line of management? Or what should be the treatment of drug allergies? The primary goal when treating drug allergy is symptom relief, and symptoms such as rash, hives, and itching can often be controlled with antihistaminic drugs or antihistamines and occasionally corticosteroids. For coughing and lung congestion, drug called bronchodilator may be prescribed to widen the airways. For more serious anaphylactic symptoms, life-threatening reaction including difficulty breathing or loss of consciousness, epinephrine may be given. Occasionally, desensitization is used for penicillin allergy, and this technique decreases your body's sensitivity to particular allergy causing agents. Tiny amounts of penicillins are injected periodically in increasingly larger amounts until your immune system learns to tolerate the drug. If one is severely allergic to certain antibiotics, there are alternative antibiotics a doctor can prescribe. So, this is all about the drug allergy. Now, I am going to discuss about food allergy. What is the food allergy and what are the classifications of food allergy? Sign and symptoms, causes, and finally diagnosis and treatment. So let's start about food allergy. A food allergy and an adverse immune response to a food protein. They are distinct from other adverse response to food such as food intolerance, pharmacological reactions, and toxin medicated reactions. A protein in the food is the most common allergic component. These kind of allergies occur when the body's immune system mistakenly identifies a protein as harmful. Some proteins are fragments of proteins are resistant to digestion, and those that are not broken down in the digestive process are tagged by the immunoglobulin E, that is IgE. This tag pool This tag fool the immune system into thinking that the protein is harmful. The immune system thinking the organism or the individual is under attack. Trigger and allergic reactions. And these reactions can range from mild to severe. An allergic response includes dermatitis, gastrointestinal, and respiratory distress, including such life threatening anaphylactic response as biphagic anaphylaxis and vasodilation. Now, classification. Conditions caused by food allergy are classified into three groups according to the mechanism of the allergic response. First one is IgE mediated, which is type 1 immediate hypersensitive means hypersensitivity reactions and oral allergy syndrome. Second one is IgE or non IgE mediated, which is allergic eosinophilic esophagitis, allergic eosinophilic gastritis, allergic eosinophilic gastroenteritis. Third one is non IgE mediated, in which food protein induced enterocolitis syndromes, food protein proctocolitis or proctitis, which is usually seen in case of ulcerative colitis or in Crohn's disorders. You can say in inflammatory bowel disorders. Food protein induced enteropathy. An important example is celiac disease, which is an adverse immune response to the protein gluten. Milk soy protein intolerance is a non medical term used to describe a non IgE mediated allergic response to milk or soy protein during infancy and early childhood. In this heinous syndrome, in this category, another disorder is heinous syndrome, a lung disease due to formation of milk or protein or IgE antibody immune complexes, also known as milk precipitants, in the bloodstream after it is absorbed from the GIT tract. The lung disease commonly causes bleeding into the lungs and results in pulmonary hemosiderosis. Now, you can see some signs and symptoms of food allergy. Symptoms of allergies vary from person to person, and the amount of the food needed to trigger reactions also varies from person to person. And the classical immunoglobulins, IgE, mediated food allergies are classified as type 1 immediate hypersensitivity reactions, and these allergic reactions have an acute onset from second to 1 hour and may include itching of the mouth, lips, tongue, throat, eyes, skin, or else areas. Another symptom is swelling, that is, swelling or angioedema of lips, tongues, eyelids, or whole face. Difficulty swallowing, runny or congested nose, hoarse voice, wheezing, and or shortness of breath, nausea, vomiting, abdominal pain, or a stomach cramp, lightheadedness, anaphylaxis, and fainting. So, this is all about symptoms of food allergy. Now, what are causes of food allergy? One of the most common food allergy is sensitive to peanuts. A member of a bean family, peanut allergy may be severe, but children with peanut allergy sometimes outgrow them. Tree nuts, including pecans, pistachios, pine nuts, and walnuts are also common allergens. Sufferers may be sensitive to one particular tree nut or to many different tree nuts. Seeds, including sesame seeds and poppy seeds, contain oils where protein is present, which may elicit an allergic reactions. Egg allergy affect about 1 in 50 children, but are frequently outgrown by children when they reach age 5. Typically, the sensitivity is to proteins in the white rather than the yolk. Milk is also a causative, maybe also a causative agent. Milk from cows, goats, or sheep is another common food allergen, and many sufferers are also unable to tolerate dairy products such as cheese. A very small portion of children with a milk allergy, roughly 10%, will have a reaction to beef. Beef contains a small amount of proteins that is present in cow's milk. Other food containing allergens or allergenic protein include soya, wheat, peas, shellfish, fruits, vegetables, spices, synthetic and natural colors, and chemical additives. People with latex allergy often also develop allergies to bananas, kiwis, avocados, and some other foods. Now, a question may arise, how is a diagnosis of food allergy made? So, the diagnosis of food allergy starts from a combination of an investigation and the patient's clinical history, a clinical examinations, and a test for the detection of IgE antibodies. As you know, a skin prick testing and blood tests are used for this purpose, and the presence of a specific IgE doesn't necessarily lead to symptoms. Therefore, it is sometimes necessary to perform a provocation or challenge test with the suspect food, which involves introducing the food to the patient, first by touch, then by ingestion of gradually increasing amounts. Challenge test must be performed in a hospital or clinic where any serious reactions can be safely managed. Which test to use to get an accurate diagnosis is made by considering the case history and the suspected food and the severity of the symptoms and the availability of the diagnostic reagents. In general, although progress has been made in the diagnosis of food allergy, many limitations still exist and more sensitive diagnostic tests are required. Now, what would be the treatment for food allergy? So the main stay of treatment for food allergy is avoidance of foods that have been identified as allergens. For people who are extremely sensitive, this may involve the total avoidance of any exposure with an allergen, including touching or inhaling problematic food, as well as touching any surface that may come into contact with it. Treatment consists of either immunotherapy, desensitization, or avoidance. Areas of research includes anti-IgE antibody and a specific oral tolerance induction SOTI. I am repeating, just a specific oral tolerance induction, which have shown some promise for treatment of certain food allergies. If the food is accidentally ingested and a systematic reactions occurs, then epinephrine or adrenaline should be used. It is possible that a second dose of epinephrine may be required for severe reactions. Other treatments include epinephrine, antihistamines, diphenhydramine, also known as Benadryl, and steroids orally or through injection or by nasal spray. So, this is all about the drug allergy and the food allergy. Thank you.